Hello and happy Nurses Week to all my nursing friends and colleagues. And I'm doing it the last day of nursing week because the whole week I was reflecting on what is it about nursing? What is it about nursing that we love? What is it about nursing that people misunderstand? What is it? Because most people think about nursing that it's a caring profession, that we're compassionate, we care for people. Well, I look at it a little bit differently now that I reflected on this, and it was a good way of looking at all the wonderful things that nurses do. But one of the things that a lot of people don't understand is the amount of information that we have to work with at any moment in time, and how much procedural information we have to retain from day to day and change and grow with it as we find out. Just medication administration, doing a dressing change. You guys have no idea the amount of information that needs to be kept in our head, and also translate that into practical application. So happy Nurses Week, but also happy reflection on how smart, dedicated, diligent, hardworking, clever, inventive, how struggling, how much character, all these things nurses have to have, and grit and bravery and courage to do the things that we do and the things that I've done. The courage to stand up and speak up when you need to, and we've got to do it a lot. Advocate for patients, advocate for those that can't advocate for themselves, that can't speak up for themselves, especially if they're out cold and they're intubated and they're ventilated and they have drugs on board and no one is speaking out for the benefits. Sometimes people forget in the mix of things, all the things that we do, that there's a human being in there and that we need to protect with dignity and respect and humanity. So I give kudos to all the nurses who see that, who actively maintain that dignity, that respect, that humanity, but also that they maintain their professional accountability, responsibility, and education. It's not easy, and we make some really difficult choices, ethical ones, moral ones, even for ourselves, when we believe something is off and you just say, hey, wait a minute, something's not right here. Very few understand how hard that is to do, because we want to take care of people, but at the same time we have to stand up for something we believe in. So I think nurses sometimes forget to give themselves credit for what they do, what they have done, and how much nurses are also used as little middlemen in appearance, while they have their own scientific process, their own educational materials, their own knowledge base, and can initiate things that you wouldn't know. The public would not understand that we can actually initiate those things. And with that, we save lives. And we also create relationships. We also help people get back to function, help them cope with things that are very difficult. And we see them at their most vulnerable and most horrific times, and we help them maintain dignity and maintain some semblance of respect and self-love and self-acceptance through very difficult times. And not just the patient, but also families and friends, all that are around that person. Because nursing isn't just about one person that we take care of. It is about the community that they live in, and the community that we all live in. And that community can be religious, it can be cultural, it can be race, it can be ethnicity, whatever that may be. Also, we take care of that community within that area of whatever their issue is. So we do a lot, but we do it with kindness, with patience, with respect, and with knowledge, and a lot of education. Nurses have to continue their education nonstop to make sure that we are on top of things. So nurses, my colleagues, my students, my friends, Keep doing what you do. I love what I do. I have been in many different areas of nursing, and now I've ventured into some other things and soon be announcing some things. But for now, just be as you are and give yourself credit. You're doing a good job, and you always have done a good job. Happy Nurses Week.